Dr. Quinn here. I wanted to explain something to our patients and future patients, and just how we screen, why we screen a certain way, and how we find out what's going on in your system. One of the things that makes our office a little different is the fact that we use a lot of motion palpation in our screening, and this is something that a lot of very well-known chiropractors and physical therapists have been using for decades, but hasn't made it into some of the mainstream chiropractic realm. One of the things that the old school doctors would look at when they're checking your spine is what we call a static position. So they would feel your spine, and if they felt that something was shifted, the whole idea was, okay, we need to adjust this to this direction. Come to find out, a lot of people have things like anomalies in their spine where this bone may have actually just formed on a different angle or something. We see that on x-rays a lot. I actually have a couple in my spine where the students used to keep feeling this one joint that just felt like it was always pushed over to one side. And so they kept adjusting it, trying to push it back into alignment. The reason why that model is not working as well today is it's not looking at the actual motion of the spine. So when we are checking you guys, when you're sitting on the table, a lot of times we will look at, first we'll start off with, these lower hip joints. We call this a little quick screen, and we're checking to see if you have a little bit of springiness in the joint. And what we want to see is that you move a little bit here. Now what we find a lot of times is, let's say you're pretty stuck through the middle back, through the rib cage, and these joints don't want to move. When I push up here, this whole area moves as one large piece, and then many people will find that it's not even the spot that I'm pushing on that hurts, but it's something else. And what that tells us is these ones that are actually stuck aren't moving, but now this one down here is actually moving too much. So when you feel that kind of pinch, a lot of times that's a spot that needs more stability or needs to bring some inflammation down. So where it hurts, you'll hear us say this over and over again, ice where it hurts. Don't heat and stretch right in the painful spot. It's a big mistake a lot of people make, and we still see it. Where, how many people do you guys know where your lower back hurts, or they say, yeah, my back hurt, and so I put a hot pack on it and I've been stretching it and stretching it and stretching it, and then how many of them does that fix everything and they're out of pain completely? Not a lot, right? So if that was truly the solution, they'd be able to heat and stretch and it would just get better on its own. What we find is when we're screening, we'll find spots that aren't moving super well, and we might find that it's actually the opposite side of where you hurt. So very commonly, biggest thing we'll see for lower back is problems in the movement of this joint, in this joint, or even the front pelvic joint, especially for new moms that have just gone through a pregnancy, given birth. This joint can get completely dislocated or shifted, and we'll see those on x-rays a lot of times. So when we do our screen, you'll notice that we actually screen first. We'll see where you're stuck, and a lot of times you guys don't even need to tell us what's going on, because if we figure out how you're moving, that tells us why you're having the symptoms in the first place. The next thing we'll do after we screen you and we adjust maybe a couple areas is that we'll actually recheck you. The reason for that is, as we adjust an area that's locked up or stuck and we're doing an adjustment there, the rest of the system will change. So even though you might feel pain in your neck, we might do a shoulder adjustment and all of a sudden the neck starts to feel better. So even though it's tempting for a lot of people to want to, especially the chiropractors, they love to get that popping noise out of the neck, I would say 99% of the time, when we do a neck adjustment, it's not in this middle portion of the neck, which is where a lot of people feel it. They usually need this area that we call them the little transition areas. So where the neck goes into the shoulders, in the middle back, in this area where middle back goes into lower back into sacrum, and then hip joints. But in order for us to address your issues properly, we have to check all the joints around here, because you might have an issue in your hip, knee, ankle, shoulder, elbow, wrist that are causing tension or pulling on the spine in certain ways. So you might feel pain somewhere, but we have to adjust something else. So I just want to briefly give you a breakdown of that. It's a lot more complicated than that when we check you guys, because everybody's got their own unique things. I'll make sure to put up some pictures of my anomalies so you guys can see what I'm talking about and realize we see it all the time. All right, that's all for today.